The big ones are acute leukemia. So there's acute lymphoblastic leukemia, or ALL, and acute myeloid leukemia, or AML. And leukemia gets its name by the types of cells that you see under the microscope. So there's lymphoblasts, so ALL, and there's myeloid cells, or AML. And there's also another disease called myelodysplastic syndrome, where the bone marrow, which is the manufacturing site of the blood-forming cells, has an abnormality associated with it in terms of the cells as well as the environment of the bone marrow itself. So those are the three top disease indications for an allogeneic stem cell transplant. In other words, when you get someone else's blood-forming stem cells, that's allogeneic stem cell transplant.
Okay, so what is the role of the bone marrow versus the blood itself? I had thought that the marrow is where, I guess all the red and white cells are produced.
Yeah, that's exactly right, Rich. So you can kind of think of the bone marrow itself. So when you touch your arm, there's the hard bone that's called the cortex. On the inside of the hard bone is a spongy layer called the bone marrow. And that bone marrow is literally like a bird's nest. So there's lots of different cells that are involved or inside the bone marrow. And the blood-forming or hematopoietic stem cell, that's like the egg inside the nest. And so that hematopoietic stem cell divides into itself. That's why it's called a stem cell, but it also differentiates or becomes the circulating blood cells, like the white blood cells, which fight infection, red blood cells, which carry oxygen throughout our bodies, and platelets, which help us to stop bleeding. So this master cell, this master hematopoietic or blood-forming stem cell, is what we collect at the NMDP from patients in order to provide as a stem cell graft to transplant patients who have hematologic cancers like the leukemia, as I mentioned, lymphomas, and myelodysplastic syndrome.
Can you only take them from the bone marrow, or can you take them from the circulating blood?
Yeah, great question. So there are three sources of hematopoietic stem cells. One is the bone marrow itself, because that's where these cells live. The other is peripheral blood, and we'll talk about that in a second. And the third is from the umbilical cord. So when a woman gives birth to a child, obviously the fetus comes out, that's a living human being, but the placenta then comes out, and the physician can access the umbilical cord, the vein there, and withdraw blood, and that's a stem cell source. That's umbilical cord blood. Bone marrow, we do bone marrow harvests where donors are usually put to sleep, and we access their hip bone and literally pop through that cortex part I call the hard part, and you actually end up with the needle and the sponge. You withdraw and you do several collections from bone marrow stem cells. And the third is the peripheral blood, as you mentioned. So again, I talked about the hematopoietic blood stem cell as being the egg in the bone marrow. You can also kind of think about it as a ship, or a boat rather, at the dock. So the reason why the boat stays at the dock is because as ropes that are tethered to the dock. So we have certain medicines called growth factors that literally could clip the ropes so that the stem cell or boat kind of drifts into the bay and ultimately into the river. So that's the analogy of the stem cell. It's called stem cell mobilization. So we use the cytokine to take that egg and to basically have it enter into the bloodstream. And that's what we call stem cell mobilization. So that's how we get peripheral blood stem cells, is that process.
So you cause the bone marrow to release some of these hematopoietic cells, stem cells, into the blood itself.
That's correct. Yep. So we literally can kind of goose what happens naturally. So we normally, all of us, have these hematopoietic stem cells, because if we didn't, we wouldn't survive, because of our circulating blood cells have a finite longevity to them. And usually, for example, the white blood cells tend to be the ones with the shortest lifespan, and versus the red cells and platelets.